Hello, I'm Elizabeth Chisato, and in this presentation, I aim to discuss the settings approach to health promotion practice. As our ever-changing world continues to face health challenges, both familiar and new, our health priorities and promotion areas have evolved correspondingly. It was earlier believed that medical knowledge and technology alone would solve health problems. However, it became increasingly evident that this narrow-focused biomedical approach had a limited effect on the health of populations. Therefore, a holistic approach to health was introduced and was used as a philosophy for care and health promotion. According to Talbot and Verinder, if health is defined as merely the absence of disease, health promotion will be limited to the prevention of physical and medical ailments, rather than taking a holistic view that encompasses mental, social, and spiritual health. In further development of the ideal shape of health promotion, an approach that shifts away from the behaviorally focused health promotion of previous decades was elaborated and confirmed in Sundsvall, Sweden, 1991. This was the settings approach. The settings approach to health promotion emerged following the inauguration of the Ottawa Charter in 1986, which states that health is created and lived by people with the settings of their everyday life where they learn, work, play, and love. This multidisciplinary approach aims to maximize disease prevention holistically through integrated action. By health promotion taking into account that contextual factors are important health determinants, the settings approach would make these concerns the object of inquiry and intervention within the operation of the setting. There is more emphasis on strategies for social, economic, and environmental change and creating a healthy setting in a positive and holistic sense, rather than focusing on the psychology of individuals. According to Torp, Coco, and Ringsberg, health should be dealt with preferably alongside the core business of the settings, not separately nor independently, and that the contextual factors of the settings interact with other settings. The principles integral to the settings approach are genuine participation by the community and all key stakeholders, partnership, empowerment, and equity. The development of settings-based health promotion initiatives have included settings such as cities, villages, schools, workplaces, and hospitals. The following slides are focused on a case study in a hospital setting. The case study conducted by Anne Johnson between 1994 and 1998 at a major specialist hospital in Adelaide, South Australia, examines the process of sustainable reorientation and evaluates what factors allow for successful health promotion in this setting. Hospitals and the people who provide care in these institutions possess a reputable position within the healthcare system and in society. The provision of readily available health service resources, professional skills, and medical technology enables communities to easily identify with hospitals, hence an ideal setting for health promotion. Power to acquire extensive resources can therefore bring about an increase in resources dedicated to health promotion and, in time, health benefits to a community. The staff of the Adelaide Hospital engaged in health promotion activities impacting the health of patients and their families, their staff, the organization, physical environment, and the broader community. Disease management and prevention and activities oriented towards patients and their families were implemented through strategies such as health education and health counseling, and the development of partnership and care relationships between staff and patients and their families. Adelaide Hospital staff instigated community-oriented health promotion activities by building relationships with consumers and a range of community groups and organizations, both within and outside the health sector. This is an example of intersectoral action. By collaborating, demands for health education resources are heightened, and opportunities to launch health promotion projects that impact on the health of targeted groups within communities are more likely. Such projects include Never Shake a Baby, Folate Before Pregnancy, partnerships with youth, State Food and Nutritional Health Promotion Project, State Asthma Program, Lock Up and Away Poison Prevention Project. In regards to community education, monthly health seminars, hospital awareness program for children under 7 years, infant cardiopulmonary resuscitation program, and health and illness information are accessible on the internet, on social media, and of course at the hospital itself. For staff, immunization, women's health clinic, nutritious hospital food for staff, lunchtime walking groups, and staff aerobics class were introduced. It must be noted that health promotion activities oriented towards staff were not seen as priority amongst clinical staff. Instead, the clinical staff prioritized the focus on patients and their families. It was the Corporate Services Division of Health who organized these activities. Organization health promotion included organization-wide programs related to occupational health and safety, infection control program, and no smoking policy, which also comes under continuous improvement projects in quality management. Other examples of continuous improvement projects in quality management are waste management programs aiming to reduce medical and general waste, as well as improvement of recycling, and strategies to reduce energy consumption and greenhouse gas emissions, all of which are also the physical environment activities to health promotion. These activities can impact not only on the physical environment of the hospital setting, but can be extended to the broader community. Ultimately, an abundance of staff members at all levels of the setting took part in the organizational and physical environment activities, which resulted in significant savings in cost to the organization. By implementing all of these health promoting activities, the case study found 5 key elements of a successful hospital health promotion program. It includes strong leadership at different levels of the organization, incorporation of health promotion into the hospital's vision and strategic role statements, policies, service agreements with divisions, as well as a specific health promotion policy, strategic, operational, and evaluation plans for health promotion, staff development and education, and lastly, the allocation of human, physical facilities, and financial resources. According to the case study, unless each of these key elements is present and supportive of health promotion within a hospital, then a significant organizational reorientation to health promotion is unlikely. The level of organizational commitment made by the hospital is also a factor that challenges the success of a health promotion program. Merely doing a health promotion project and delegating it to the role of specific division, department, or staff convey a low level of commitment as health promotion actions are not integrated into the practice of staff throughout the organization. The main issue with these two approaches is sustainability. Although doing a health promotion project are well-intentioned and organization commitment or support from senior management are initially attained, lack of organizational infrastructure for support of the efforts made by staff may force the collapse of these efforts, whereas higher levels of commitment showcase higher success in developing a sustainable approach to becoming more health promoting in the hospital setting. This is achieved through the approach of being a healthy promotion setting and improving the health of the community. This allows the balancing between projects oriented towards the setting and projects for community health. I have mentioned the challenges of sustainability in terms of support for health promotion activities and change. Insufficient support include financial and time resources, training, and consultancy expertise. Further challenges to the settings approach may be difficulties in translating the philosophy of this approach to the practical activities within the setting or competing forces within the setting that may act against a health agenda, internal pressures to produce a successful project or the fear of failure, and the issues with the credibility of the targeted organizations or sector to be collaborated with, or even the health promoters themselves. With that being said, practitioners should possess the following skills and knowledge when working in this area of health promotion: being able to shift away from the roles of a traditional medical expert to a change facilitator, and improve organizational development through intersectoral cooperation, negotiation, and ability to influence the creation of infrastructures, which requires social skills, group leadership, organization competencies, and project management. The settings approach has delivered a range of successful outcomes that have been of benefit to health promotion. This includes an increased awareness of health issues, development of health promoting policies, and creation of dedicated health promotion budgets, more frequent and better partnerships, development of discrete health promotion or education projects, changes in various individual attributes, behaviors, and function, and lastly, the economic benefits. In conclusion, this holistic and multidisciplinary approach increases the likelihood of success for health promotion. Health promotion practitioners or members of the setting can optimize interventions for specific contextual contingencies and target crucial factors within the organization's context. Furthermore, the approach has made substantial contribution to intersectoral action and healthy public policy approaches. Thank you.